The NICU 12A is located on the 12th floor of the main OHSU hospital building next door to labor and delivery. Not physically in Doernbecher Children's Hospital, but on the same campus. The Unit 13C, where patients recover after giving birth, is one floor above the NICU and labor and delivery 12C. Babies come to our NICU for many reasons. Sometimes it is because they are born very early and will need to be in our NICU for a long time. Sometimes they might need help from doctors that provide specialized care. Sometimes a baby might just need a little help with breathing or eating and might only be in a NICU for a couple of hours or days. If your baby is born at OHSU and needs to come to the NICU, they might be taken to our infant stabilization room. We also have babies that are transferred to our NICU from other hospitals because that hospital might not have the kind of medical equipment or specialists that your baby might need. Our unit is a secured unit. When you arrive to the NICU, you will check in at our visitor front desk. Our receptionist or HUC will help you with an access badge and explain things like bags for cell phones and removing jewelry below the elbow. All visitors are required to screen themselves daily for any signs of illness. If you have any symptoms of a contagious illness, such as fever, cough, vomiting, or diarrhea, we ask that you do not visit to prevent infection in NICU patients. Our unit is made up of 9 pods and 2 isolation rooms. We also have an additional space for our babies located on 13C. The isolation rooms are for babies with particular medical conditions. If this applies to your baby, we will talk with you in more detail. Each pod is a large room with several babies so that your nurses can always see and monitor your baby. We do not have a place for parents to sleep within the NICU, but there is no restriction on the times you can be with your baby, and you are always welcome to call for updates. We also have 1 bathroom for visitors in the unit. There are additional bathrooms located just outside the NICU entrance. It is also common for babies to move to different pods throughout their NICU stay. Your baby will never leave the pod without you knowing. If your baby moves to a new pod, there will be a sign at the NICU front desk to notify you. There are several types of beds available depending on your baby's needs. We also have breast pumps, recliner, and gliding chairs, and divider screens for privacy available to be at your baby's bedside. Every baby in the NICU has their vital signs monitored continuously, including heart rate and oxygen saturations. Depending on your baby's medical needs and condition, there are several ways they may receive nutrition or food. If you are planning to provide pumped milk, we can store your milk in the NICU to feed your baby by feeding tube or bottle, or to save until they are able to eat. We also have breast pumps and lactation specialists available to help with breast pumping and breastfeeding. The other ways that we feed our babies include IV nutrition, nasogastric or NG, gastrointestinal or G-tube, or by breast or bottle. There are many different people that will be involved in the care of you and your baby. These are just a few of the many providers that will be a part of your care team. Our doctors and other providers will come by every morning to talk about your baby and their medical plan for the day. We also call this rounds. Parents are encouraged to participate in rounds. We also want parents to know that you can ask questions at any time. We know that this can be a confusing and overwhelming place. If you are unsure of something or have a question, please let us know. Parents are encouraged to be with their baby as much as possible in the NICU, but there is no designated sleeping space. If your baby is born here, parents will have a room 1 floor above the NICU in 13C. Once the birthing parent is discharged, our social work team can help coordinate or identify lodging options nearby if you do not live in the Portland area. We have patients referred from all over the region, and some families might be eligible to stay at the Ronald McDonald Guest House or a hotel. Parents who are providing milk for their baby are eligible to receive meal vouchers that they can use to get food from the hospital. Some families might be eligible for additional meal assistance. Our social workers can talk with you more about this when you arrive. Parents are encouraged to be present at their baby's bedside in the NICU as much as possible. There are no specific hours or times of day in which parent presence is not allowed, and there is no limit on how long you can be at your baby's bedside. For other visitors and relatives, the only time they are not to visit is during the nurse's change of shift, which is from 6:30 to 7:30 a.m. and 6:30 to 7:30 p.m. each day. You are a vital part of your baby's care team. Your baby's nurse will help encourage and show you how to safely participate in your baby's care, including holding, feeding, diaper changing, checking temperature, and practicing any tasks that you will need to do after your baby goes home from the hospital. We have a team of child life specialists who can help your children and help you communicate with your other children about their baby sibling who is ill or premature. We can talk with you more about this when you arrive. Our NICU provides diapers and wipes for your baby. You will not need to bring your own. We also provide bottles, pacifiers, and any other care items that your baby will need. Most of our babies do not wear clothes, just diapers and a swaddle blanket, but we can provide onesies and other baby clothes when needed. You are also welcome to bring clothes for your baby if you would like. You are also allowed to keep a few personal items at your baby's bedside, like pictures, drawings, and books. But please remember that space is limited. Your nurses can help answer questions about this when you arrive. We encourage parents to pump milk at the bedside if desired and have electric hospital-grade pumps available for use. We also have several lactation pods located outside the unit. If you require a language interpreter, we have interpreters available in person in addition to an iPad for 24/7 audio and video support. Thank you for taking the time to watch this video. Please visit our NICU website for additional information. All of this information will be covered again once you arrive in the NICU with your baby. We are honored to be entrusted with the care of your baby and look forward to partnering with you during your baby's hospital stay.